Hi, I'm Dr. Leia Lacuesta-Corro. I'm a practicing internist specializing in clinical nutrition, and I'm currently affiliated with the Healing Well Center of the Davao Doctors Hospital. It's 2021. A new year has come again. Because of the new year, many of us will engage or write up new goals, and usually part of those goals are healthy eating or healthy diets. Many of us will go through what is seemingly the easy way to diet and therefore engage in quick solutions or fad diets. Some of us will have the patience to go to the doctors or to the dietitians to consult for a healthy meal plan. And some of us or many of us are still clueless about what step or what road to take in terms of healthy eating. One of the goals when we say healthy diet usually pertains to losing weight. So many of us, having gained the extra pounds over the past months or in fact over the past year, would want to start losing weight, and they will say how much, they would ask how much do we need to lose, doctor? Or when they go to their nutritionists, they would ask how much do we need to cut in our diet. So usually, what gets sacrificed are your sugars or your carbohydrates or even your fats. Some will engage in fasting. In fact, some of them will engage in drastic diets that are totally difficult to achieve. But before we even think of engaging in any diet or in any fasting, we need to consult our doctors first, because some of us or many of us might have other medical conditions that we need to take into consideration before we engage in these diets. Because no matter how good the intentions of these diets are, it may not have the same benefits if you have other medical conditions that will be affected. Part of the discussion of losing weight is also knowing what your BMI is. So what is BMI? It is a measurement taken or computed from your weight against your height. Now, if your BMI is above 30, then you are considered obese. If it is above 25 but below 30, you are considered overweight. And if your BMI is below 18, you are considered underweight. But it doesn't matter if your BMI is normal, if your muscle mass or the muscle part of your body is low and is monopolized by your fat mass. However, despite a normal BMI, it does not mean that you are already healthy and do not need to look after your diet or your health, because a normal BMI may still have, you may still have a high fat mass and a low muscle mass, and we should still pay attention to this and make the necessary dietary revisions. So usually when we want to go on a diet or when people want to go on a diet, the first things that get sacrificed are your sugars or carbs in general and your fats. But without assessing totally the diet that you engaged in for the previous months or even years. Now, we have to quantify and qualify the kind of carbs that we are supposed to reduce and not necessarily eliminate. Aside from cutting out certain food items in our diet, we must also assess other undesirable dietary habits. And this will probably include our consumption of fast food products, and also the frequency of our intake, as well as our sleeping habits, our propensity to take in sodas or desserts, and how often are we actually eating the healthy kinds of food. In general, a healthy dietary habit would mean eating a balanced diet or a balanced composition of all the macronutrients and also your micronutrients. We cannot discuss one without the other. Speaking of micronutrients, there are a number of concerns wherein many are asking if the intake of supplements, of different supplements, are beneficial, especially in these times. Do we really need the extra dose of micronutrients? Will this protect us? Will these alone protect us? My comment on this is that if it helps to ease our anxiety, then I have no objections to taking the supplements. But if we are able to translate the intake of these micronutrients and incorporate this in the diet, then it is much better. So we have to ensure that we are eating adequate amounts of fruits and vegetables within our diet to guarantee that we will be able to reach the adequate or average daily requirements of our micronutrients, because it is because it is through the fruits and vegetables that we are able to mainly get our micronutrients. Any excess intake of these micronutrients will just be discharged from our body by means of our urine or our bowel movements. So what actually comprises, or how do we define good and bad food? Is this mainly defined by the different food choices that we make? By eating one specific food item which is labeled as good, are we already having a healthy diet? Not necessarily, because no matter how foods are described or labeled as good, but if we take them excessively, then this can still be bad for our health. In the same note, it does not mean that if one food item is labeled as bad, it does not mean that we cannot take them anymore at any amount. So the point here is, we can actually eat anything we want as long as we know that we are eating them in moderation. And if you want to have an idea of what eating in moderation is, then our nutritionists, dietitians are very much willing to compute or provide you with a meal plan, and wherein you can get your you can have an idea of how much you're supposed to take in depending on each food group. It may sound too meticulous or too challenging, but actually when you get the hang of it, it becomes easy already, and without any pressure of having to take any supplements or having to cut out anything from the diet. One other aspect of healthy eating is for us to actually learn or develop the appreciation of nutrition labels. So when we do the groceries, it's not enough that we will be able to choose the healthy food items. It is also good that we are able to appreciate the nutrition labels that are seen at the back or at the side of the packages. Why is this so? It does not mean that if the packaging says it's good for you, it's healthy, it's low fat, low carb, then you take it hook, line, and sinker. So you have to appreciate the nutrition label to actually gauge if what you are consuming is good for you or not. Why is it important to appreciate or look or inspect the nutrition label at the packaging? It is important because through the nutrition label, we will be able to know the number of servings per packaging. We will be able to know how many servings there are in a package. We will also be able to know the ingredients, if there are any artificial components or ingredients in the package that we need to be aware of. We will be aware of how much fat, how much carbohydrate, and how much protein, as well as how much micronutrients are inside the packaging. Sometimes these packages are fortified with micronutrients, for example, with vitamins like vitamin A, vitamin D, and vitamin K. And these will be important or be beneficial, especially if you need an extra dose of those micronutrients. So that's why it's very important that we check the nutrition label. We must not take our food items or our grocery choices at their face value. Hence, we should be able to inspect also the nutrition label. So we must know what we put inside our mouth, so we will not have any chance of consuming unhealthy ingredients as well. So there are questions regarding specific diets, particularly your keto diet and your intermittent fasting. Generally, I have no objections to both diets as long as they come in with supervision of your doctors and your nutritionist dietitians. Why is this so? Because some people may engage in these diets but may have also concomitant medical conditions, and this might spell the difference between a successful diet and a complicated disease. So you have to get first the approval of your doctor and the supervision of a dietitian, so that you will be guided with what to do with your chosen diet. Another thing is that not everyone will be able to adjust to the keto diet or to the intermittent fasting diet, because perhaps because of the nature of their work, or perhaps if it's a far cry from their original diet. If you are someone who are used to consuming a lot of carbohydrates, having an entirely different reviews of food intake, then suddenly engaging in a very stringent diet such as your keto or your intermittent fasting diet may be very discouraging. So once patients sometimes will be discouraged because they cannot stand the difficulties or the challenges that come along with these diets. So I will really recommend that you get the supervision of an expert, so that you will not fall victim to any complications later on. For example, in keto diet, this will entail you cutting down drastically your carb intake and seemingly allowing you a lot of fat intake. But people may misinterpret this as being allowed to eat any kind of fat for that matter. And this is where the difference will lie, because your fat choices in keto diet are actually qualified. So not all fats are allowed in keto diet. So there is a list of good fats that are considered to in keto diet. So this is where the common mistake is with patients, because they apply it from their own perspective and just consume a lot of fat and end up having cholesterol problems or additional or complicated heart conditions or complicated diabetes and other medical conditions. I have no objections to taking supplements, especially in these times, because we will need all the boost that we can get. But we must remember that we cannot rely alone on these supplements to ensure a healthy lifestyle or a healthy immune system. We must still remember that these supplements go hand in hand with a healthy diet. So a healthy diet will always mean a balanced diet, adequate intake of carbohydrate, fats, and protein, and it includes your fruits and vegetables, so that you have an ample amount of your micronutrients. If you are able to maintain an adequate and balanced diet, then ultimately you wouldn't be needing these supplements. Although weight loss is a target for many people because they think that it is the only way to go healthy, there are some people who, despite eating adequately and even excessively, will experience unintentional weight loss. The people who commonly experience unintentional weight loss are usually our elderly people, because sad to say, at the age of 40, we already start losing our muscle mass. and consequently lose weight also. Now, some people may be happy about this because that is what they want. They want to lose weight. But if you are losing weight by losing muscle mass, then that is also not beneficial, because it is our muscle that actually provides us extra energy when we get sick. So we must make sure that if we do lose weight, we lose the fat and not the muscle mass. There are people who, despite eating adequately or even excessively, still experience unintentional weight loss. If this happens to you or to a loved one or someone you know, you should tell them to seek consultation with their doctors already, as there may be an underlying medical condition that has led to this unintentional weight loss. The sooner that they are able to seek consultation, the better it is for them to ease the anxiety. And if they need any medication, it will be started immediately. When asked what is the best way to lose weight, my answer is always that it's not the only way to a healthy lifestyle. Having a normal BMI or targeting for a normal BMI does not necessarily mean engaging in healthy dietary practices. We have to take into consideration what was your previous or current BMI. For example, if your BMI was 35, it is highly impossible for you to achieve a normal BMI in just a few months. So it takes a habit and a good dietary lifestyle to achieve this. And there is no race to a healthy body. There is no race to a healthy lifestyle. As long as we start to aim for that, then that is already a good start. So BMI is not our only basis for achieving a healthy weight. There's a question here: does time in a day matter when it comes to eating? My answer to this would be that what would be more relevant is the interval of your eating. So if you eat more regularly in terms of interval, then that is more healthy, because through that you will be able to stabilize your insulin levels and prevent you from possibly developing other metabolic conditions such as your diabetes. So that is what we actually encourage: regular eating, regular time intervals in terms of eating. We cannot impose a fixed time for our main meals such as breakfast, lunch, and dinner. This is so because we have different time schedules depending on the nature of our work. We have to take into consideration those who do the graveyard shifts, whose sleeping time might start at breakfast. So we cannot impose this on them. Otherwise, we will not be able to encourage them to follow a healthy diet if we disturb their schedules. My parting message to everyone is that a healthy diet does not necessarily need to start every new year. As soon as you recognize that there are undesirable dietary habits, then you can immediately aim for a healthier lifestyle. And a healthier lifestyle does not necessarily mean cutting off certain food items in your diet. You just need to eat them, or eat a balanced diet. Eat everything in moderation. But should you need our assistance, you are very much welcome to visit the Healing Well Center at the ground floor of the medical towers at the Davao Doctors Hospital. We will be able to assist you with your inquiries and provide you with the necessary meal plans and other services that are available in our center anytime from Monday to Friday. So as the name of the center goes, to be able to heal well, you have to have a healthy diet. And we are here at the Healing Well Center to provide you with the services that your well-being will ultimately require. Thank you very much.